Representative Dedeaux, you're a staunch supporter of House Bill 1120, which is the Rural Physician Retention Grant Program. Can you tell us about this program and why you believe it's necessary?
Yes, Terry. Mississippi has a wonderful program right now called the Mississippi Rural Physician Scholarship Program. It starts out when young people are at the high school level and mentors them all the way through the undergraduate and medical school process and helps them financially with the understanding that they're going to return to those medically underserved and rural communities in our state and serve as a primary care physician. And so that program has already gotten about 30 young people into the medical field that we know are going to one day return to the rural communities in our state, to the medically underserved communities in our state, and be a primary care physician for the people in our state. About 3/4 of the state is considered medically underserved. And so this is a very important issue to my district, which is a very rural district, as well as about 3/4 of the population of our state who live in rural, medically underserved areas. The problem is that our scholarship program that is directing students to become physicians and move into these rural communities hasn't really had an immediate impact, because you've got 4 years of undergraduate, 4 years of medical training, and then you've got a residency, and so it's a long time in the making. So what this bill will do, it will go one step further and provide gap coverage now for physicians who are graduating from medical school, getting their residency complete, and give them an incentive to move into a medically underserved area of rural Mississippi and serve that community, and it will give them a grant incentive to help retire some of their educational costs.
So this is a way to improve health care in underserved areas of the state, such as your district, right?
Absolutely. You know, most of the medical care that you think of as like the big hospitals are in urban metro areas. And so a lot of the medical community, it kind of is around that hub in the metro areas. You know, but we have areas of the state, counties in the state, with no pediatricians, no gynecologists, no obstetrical services. And so this will give an incentive to bring those skilled medical primary care physicians, pediatricians, family doctors into our local communities to serve the community needs in our healthcare community.
Now, how is this program going to be funded?
It'll be funded through an appropriation of the legislature. This is the general bill that authorizes the program. The funding of it will come through the appropriation side, and so I'm not involved with that part of it.
Do you anticipate any problems in finding funding for this program this year?
Well, I think that providing health care coverage in rural areas of the state is a priority of the state legislature. I think that in spite of the fact that we're in a very difficult economic time, I think that with the fact that 3/4 of our state is medically underserved with primary care physicians, I think our legislature will be willing to make this a priority in this difficult year.